Good morning to you, St. Lucia. Thank you so much, as always, for joining us right here at the National Television Network. You're on Channel 122, on Facebook, the Government of St. Lucia Facebook page, as well as the YouTube channel. And we are here for another interesting, exciting, thought-provoking discussion. And I'm happy to say good morning to Homer.
Good morning, Lisa. Yes, there's another bring you the pertinent information that you need to start your day. We're keeping you informed, updated as what's happening here. It is the 28th of September. It is Tuesday, and the Ministry of Health and Wellness has come out with new figures, new COVID-19 figures for us. Should I go through that, please?
Let's go through that
yes.
Before we introduce our guest.
So, very, very quickly for you. Yesterday, the Ministry of Health and Wellness confirmed 19 new cases. These cases were processed on Sunday along laboratory from a sample of 90. So that brings the positivity rate at about 21.1%. Also, very, very good news, recovery of 720 individuals diagnosed with COVID-19. So that means our current number of active cases in the country at 1,469. Just in case you are looking to be vaccinated, to remind you, places that you could go ahead and do so, the for Parish Hall, Parish Constituent, so the Gross Human Resource Center, vaccine will also be given at People's Discount Drugstore on Victoria Street. That is by appointment only, and the vaccination sites or the distribution sites, they're going to be open from 9 to 4 p.m. So if you are looking to be vaccinated, these are the places that you visit.
And certainly within those numbers there, we do have 2 individuals who are in critical condition, while 11 others are severe at the respiratory hospital. Now, last evening, the Chief Medical Officer, Dr. Sharon Belmont-George, in a statement, did confirm that we have some 6 new cases, or 9 new cases, of the Delta variant here in St. Lucia. She received a patient from Carver. We go now to that from the Chief Medical Officer. Okay, we seem not to have that video ready as yet, but what we'll do is we'll speak now to our guest, Mr. Kentry Frederick, the Vice President there for the National Council on Public Transportation. Thank you so much for coming in. A few weeks ago, the minibus or public transportation sector, I should say, certainly there was a lot of heavy emphasis there because of the numbers that will be driven. Our COVID-19 numbers were escalating, and certainly there was a crisis within the public sector public transportation sector. You've had a number of your members pass or who tested positive for COVID-19. Can you tell us what's the mood now among the minibus drivers and operators?
Good morning, Lisa. Good morning, Homer. Good morning, St. Lucia. It's always a pleasure to be invited to try to give out the information as far as COVID-19 is concerned and how it affects the transportation sector. Because, without the passengers or the consumers, we don't have business, but also without the operators, we are not able to dish out that service. However, the information that we gave the past few weeks, we've been monitoring closely because one death with the aviation sector is too many. However, there seems to be some stability in terms of the death. However, we still have operators who are infected. Or, as a matter of fact, I spoke to 2 operators this morning, different, and they have proceeded to be tested. So with this being said, we've had meetings with the Ministry of Health, with the Ministry of Transport, and also with the Ministry of Education last week. So the whole drive is to have a different approach rather than individual ministries' approach. And I am happy at the level at which we were able to speak frank, sharing the information and then looking at how we approach it on a whole.
Right. So some of the discussions that you've had with the Ministry of Health and the members as well, know that in terms of being able to meet the protocols, there was some discussion amongst members that perhaps they needed some form of assistance in able to be able to provide those hand sanitizers and so forth. What has been the outcome of those discussions?
These discussions were very fruitful. I think I must give kudos to the Minister of Transport and also the Chief Transport Officer, including the DPS of Transport, the Permanent Secretary of Transport. What we did was a frank discussion, forgetting that you belong to different sectors. And what we noted is that the dissemination of information was critical. So what we had at those meetings were fruitful discussions, but they were quite frank in terms of saying what we believe should be. Mm-hmm. And fortunately for us, we will be getting a lot of assistance from the ministry aspect in terms of the public transportation, the public education drive. Now that will happen along with the Ministry of Education and Ministry of Health. In terms of the hand sanitizers and the other PPEs, we have two corporate citizens, businesses, instead that have reached out to us in terms of nation. I will not be giving the names right now, but this morning, just before one of the gentlemen, he contacted me. They put in everything in place so that they can reach out to us, because their staff travel with us, and we also give a service within the communities that they business. So we will that also on the government aspect of it. The Prime Minister have been through some other entities in terms of assisting us in getting hand sanitizers, the machines, also the temperature, the machine to check the temperature. The name just skipped me at this time. So we in some headway, and also discussions with the Ministry of Education is look at the possible reopening of schools, because we do understand the social effects and all of that on the school children, which is sad. But at the same time, we want the children to be back at school in a safe manner. So we are approaching it at that level. And I am very grateful for the fact that it is being done at the ministerial level, where the ministers are actually involved in those discussions. So we are making headway, we're making some good progress at this time.
Nice. I'm sure it must be a balancing act for members of the transport sector, given that you want to ensure that you're keeping yourself and passengers safe, and also the economic aspect of it as well. In terms of bus drivers taking the personal responsibility of keeping the protocols, are you guys having or seeing a difficulty with this?
It is improving, and I think as we go along the program today, I might just give you some information that maybe persons looking at that, but council have always had it in hindsight, and I'm hoping that we would be able to put it out at some point in time. It is good information that persons need to look at and realize we should have known that to be more sensitive to the cause. Mm-hmm. So with this being said, there is a drive to educate the public, the minibus operators, the owners of those, but also to have persons look at the aspect of and not just the money. Mm-hmm. Because as we have said from the beginning, the money aspect of it, the operators are not making near what they should be making, not even to pay their loans. So generally, we want to keep the country going, we want to keep the economy moving, because the day the minibus sector that they are not able to talk about strike action, that's extreme. But under the pandemic, we are looking at if we are unable to operate, obviously the economy we are trying to keep the economy going, but we are expecting that human behavior will change to allow us to be able to do it more comfortably, mm-hmm. that everybody could balanced in such a way that we are doing it safely, but at the same time with the fact that we have a pandemic dealing with.
So for the human behavior to change, it's really the attitudes now.
Of everybody.
So everyone, yes,
Yes.
attitudes of everyone. For the passengers, for the operators, for the drivers.
The drivers.
So that being said, and I think I just want to be able to just expand Homer's question, are you seeing that the drivers now are more open, assuring, being very rigid that the protocols are being adhered to, not just by the passengers, but by themselves as well, especially the carrying load,
Okay.
the numbers stipulated carrying load?
Right, so that comes in twofold. Yes, they are trying, but they have found themselves at a very difficult juncture that we need to approach the board. For example, you cannot separate a family of, for example, you have 5 persons on board. A family of 4 or 5 comes in, and then who do you put down? Because remember, you have 5, family of 5, or household of 5 come, so that's 10. But probably you had 6 and 1 comes, so you may end up with 11 or 12 in those instances. I am not saying this is what happened all the time, but there are times it happened. There are times the passengers now would say to driver, because the passengers know the drivers from the community, and they know the difficulties the drivers are going through. So what the passengers would sometimes say, look, driver, we sanitize our hands, we behave in ourselves, we want to go home, take us home. So sometimes the passengers are very adamant that they will behave themselves and they want to go home. Out of that load, you may have 1 or 2 who say, driver, you have 13, 14. The driver will say, but you all know it's 10 supposed to carry, who do I put down? You have a right not to board the bus if you think that you are unsafe to that extreme. But the problem is not the bus or the bus driver. It is human behavior that is creating the atmosphere for infections. And as we've always said, when we change our behavior, when we comply to the protocols, most of the times we have seen the numbers dropping, and then the drivers are able to give the service. They are also able to pay the loans, also able to take care of the family. This is what we're looking at, a balanced act in terms of the service we give, the pandemic we face, and then the challenges that come with it.
Okay. And so, yeah, you're right, it's a very, very difficult curve to try to manage. Vaccination, last time you were here, we had a discussion that you would be looking into the education aspect of on vaccination for your members. And there's also been mooted that mandatory vaccination for bus drivers or operators. I don't want to use the word mandatory, but certainly encourage
them to. That's where we head in, because
vaccinated. So how much progress have you made there, and are the members open to vaccination?
We have a lot of operators who have been vaccinated. We have a lot of operators who are now beginning to understand what the vaccination, what the testing is all about. So the window, I would even go as far as the door that the CMO have given off, I think is Natasha Lloyd or something. That's not right. Right. This lady have been very helpful, but we are just waiting for the minister to bridge the gap, because you understand Ministry of Education may have the concerns about the use of a school with the pandemic. So at the ministerial level, what will be happening is that the PS of Transport, Mr. Ivor Daniel, should be doing some communication with the Ministry of Health and Education to seek some of those locations for us. Because it would not be fair to have an operator who is under that much pressure to leave a day's work, especially on a weekday, to attend a meeting. So we're trying to approach it on a weekend when the ministries have actually given the okay at French schools, even if it's not the other 2 the classroom, but at least a wide area on the compound so that the Ministry of Health can do the education aspect of it. But we do have a lot of drivers who are testing, and we do have a lot that are asking about the vaccine. So we're making some steady headway, because the simple message is you are working to feed your family or yourself or your business afloat. But the means of doing that is the place where a lot can happen, including you getting sick or you losing your life. And the loss of one driver to me is too many. I would prefer if no operator would have to go through this. But unfortunately, it has happened, so we're trying our best to curb the situation.
I get that. And in terms of the collaborative effort that you've been seeing, have you heard of, you did mention that there are 2 people within the private sector that have come out to assist with PP. Have you heard, or are you seeing anybody else being interested in contributing to that cause in terms of contributing maybe PPE or otherwise?
Yes, St. Lucia is a good country, and I will say this, despite of the politics and despite of the religion, St. Lucia is a good country. There are several bus operators who have called us and say, look, a lady, a guy, or somebody just passed and say, fellas, look, a box of masks. A box of masks, facial mask, has 50 in it. So you find there are persons who are making different little contributions. Sometimes somebody would pass, look, I'm selling this and that. I'm giving you guys at least 2 or 3 bottles of hand sanitizers. So generally, St. Lucians are reaching out to the bus operators, and we are very grateful for that, yes. So sometimes if the bus operator out of the hand sanitizer, there are persons who are boarding, they would sanitize a few persons to help in the process. So St. Lucians are understanding, they are helping, but it is a slow process that we all have to grasp so that we can move forward in a positive manner.
And so what now is the permanent mechanism that you've put in place for the sanitizing of the buses? The last we're here is, there was the sort of sourcing of the, whether it be companies or methods of which you'll be able to do that. So have we been able to make this a permanent process?
Yes. We have 4 companies that have opened the doors to us in terms of getting this bus deep steam clean or sanitize or fog, whatever method you want done. It is a bare minimum if the numbers are there. So that is why when we will be doing the educational drive with the Ministry of Education and Transport, we will be able to explain to them, if the entire association is sanitizing or fogging or whatever, you have an option. We will give them the individuals so they can choose, and these individuals will actually be making the prices and all of that negotiation with them directly, because it is not a case where the government may be going to sanitize all buses or NCOPT, the local association. There may be a case where you want to shampoo and do all of that. So you have a dialogue with the business person. So they, okay, if the fogging is $60 and you are deep steam cleaning and you are shampooing, maybe I can give you a package for $120, which is the price of a car. Because these individuals who are giving the services, I will tell you, the price they are looking at offering a minute is way below the price of doing a car, a private car. So they are reaching out, but you must understand they have the material that to replace. So at least if they can break even, they are willing to do it.
Right, that sounds very, very positive. And I do hope that as well all of the members, pool their resources in order to make this something quite prominent. On the other spectrum, when you speak about the finances, and perhaps as you spoke about some information you wanted to be able to share with us, quite frankly, I get the feeling that it is to do with the finance aspect of things.
Not necessarily.
Not necessarily.
Not necessarily.
Okay.
It's just a different dimension that we never mentioned. But when I spoke with a friend yesterday, she said to me, but look, I am aware of that, and I thought by now you all would have put out. I said to her, some things we leave for now, some things we leave for later. So this general thing we're discussing, what wanting money or demanding money. We are not on that page. We are trying to survive an epidemic which can be deadly, which we know have affected us in many ways. So, the information I want to put out there to the general public and to you, I am a father, I am a brother, I'm a son, I'm an uncle, I'm a cousin of somebody out there. And yesterday I took public transportation. I did. I didn't drive yesterday. I just wanted the feel of it to see how comfortable it was. What I noted that many times we speak about the behavior of the driver, we speak about behavior of the passenger, behavior of different ministry. So we're now taking it to an individual level in terms of some difficult decisions that are being made by some individuals for the country. And that information has to do solely with that of the minibus operator. So here you have, if I may use a Leclerc bus driver, $1.50 to Leclerc, right? That driver who is now taking 10 passengers from Castries to Leclerc, that is $15 for the trip to go. He may use $10. So the value of the trip going in his pocket is only $5, given the service. Whereas he is not supposed to take 11 or 12, the pressure he's under sometimes forces him to do that for many reasons. There are financial institutions who are very kind to the bus sector, that if you have to pay maybe $800-900 a month, you give them said, they understand. Financial institutions that are brutal to some of the operators, they would even call them on a Saturday, right? Now, let's face it, we know the banks have the obligations, we know persons have the obligations. So I am just giving you a little bit of insight into something to think about. What if that operator now says, okay, I'm taking a chance, I know it's not good to do, I'm taking a chance, the passengers don't mind, we sanitize, we wear the mask, and he's caught with 12 or 13. Remember, he's not making the quota. A Leclerc minibus have to make 10 to 11 trips, maybe back and forth for the to go home with $60. That's the harsh reality. So just imagine a whole work at Leclerc to go home with $670. And you do that 3 times a week, which means for the month, you make nowhere near $1,000. Your loan is on 5 or 2, depending on what vehicle you have. And remember, all operators that changed their buses was not out trial, was to give the passenger or the consumer a better. And that is why the understanding that when NCOPT represented them, and we do give representation contrary to what persons may say, but we will get to that. What if you decide you are sending this bus driver home for 2 or 3 passengers that he's reported to? 2 things can happen. He's not making the quota to pay his loan or to feed his family, which is already terrible. You fine him $100 based on the association's constitution and all the little rules in there. You can fine or you can suspend. Don't you think the possibility exists where this operator being sent home for a week, 2-3 days, cannot make anything? The sad reality is that he may be contemplating suicide. Have we ever looked at that as a nation? And that is the that is the thing we need to tell operators who probably contemplating suicide because of the pressures, not just of COVID, but the financial pressure, and then all that is mounting up. What we are saying to the general public now, this is my intake or my output in that regard. Yesterday when I took the bus from my home to the Grosley bus stand, the driver from the Grosley bus stand, some of them do things that are not good. The gentleman I drove up, he had about 11 but somebody wasn't going too far. The Grosley bus driver was about to move with 9. He took additional to go to 10. When I got by the VG playing field, I gave him $2. He reached out to give me the 50 cents back. I didn't take it. I said, it's okay. I have a conscience because I know that that gentleman is going up and he's already making less. So as a citizen of St. Lucia, knowing what that Grosley driver is doing and his best, then came out of giving him 50 cents more. And sometimes we need to look at it that way. So what we are promoting, we know finance is tied by everybody, but sometimes consider for the day. Probably just leave an extra 50 cents or $1 for the driver. Give him a little. Because the minibus operators, they're keeping St. Lucia up and going. The government of St. Lucia have expressed, and not the SLP or the UWP, the government of St. Lucia have expressed their gratitude to us for doing that. If you noted, there was a change of government, and the minibus sector went on flawless. In that regard, the continuity was there. This is the representation of National Council on Public Transportation. We don't play politics, but rather we keep the transportation sector afloat, irrespective of which, because we try to assist the government of St. Lucia, but to represent us, which is the minibus sector. So what I am saying to the general public, consider giving the driver an extra $1, an extra 50 cents, but be nice to them because a lot of them are under extreme pressure. So I want the general public in St. Lucians to look at that dimension.
You know, final note for me. One of the important factors that you made, points that you made, was the mental impact of the pandemic. Are we looking, or NTOPT looking for possibly maybe counseling or any reprieve in that aspect for the drivers?
Yes. Fortunately, I have a few friends who does that, so I have engaged them in the discussion of giving free counseling to the members who are so affected. However, it takes a little bit of courage to come. So what we are doing is to engage persons within the different route associations to monitor the progress of some of the drivers. If you know the person is happy, bubbly, and you notice it begins to go down, let us know so that we can approach them on a different level and give them the free counseling, because we know what they are going through. And I am very happy that we went into the dimension, because some persons are of the view that council is not representing the members or the associations adequately. That is not true. We have kept the sector open for since this pandemic has been in play. Second to that, every association should have an executive in which anything that happens, whether good or bad, you go to executive, you explain it to them, and then the representative of your local association meet with the representative of council in conjunction with the Ministry of Transport to see where we can curb the problem, where we can improve on it, if you have a good suggestion where we can add it or add value to the service we give. So there is representation at all levels. What council does not engage in is differences between persons on the route. So if two individuals, their parents were in some dispute for a banana tree in 1942 and a cow, and then all of that, it boiled down to the bus stand. We don't get involved in that. We say the cow is there, they kill it and they sold it. The banana tree was eaten, it's gone. Let's get it on. There's no reason to hit anybody.
Do you know, I can actually picture you having a mediation session and saying these things.
Yeah, I do that all the time.
I think everyone will leave the table.
Yeah. Because I don't expect everybody to like me. I know persons who dislike me, but it doesn't matter. Because at the end of the day, as I've said, important in any of what is going on there. What is important is the message that I give out. And I cannot deceive anybody when it comes to anything that is going on there. No, there's no place for that. If I had a discussion with the Ministry of Transport, I had. If I did not, I didn't. What is important is that we have had many meetings, the whole of last week, I think, when you all try to reach out. Most persons, HGS, and those stations, I would just send them a message. Meeting. So one said to me, he would change my name from, to meetings. And it's just a thing, because the media help us. It's not about being on TV or being out there. That is of no significance to me. What is important to me is that I'm given the opportunity to speak the truth and to help persons save their lives. Because it is sad to know that your father, your uncle, your brother leaves home to try to make $1 to feed the family, and he may end up sick or dead. So the message we want to put out there in time is of essence is that we change the human behavior, head to the protocols, put the politics, put the religion aside. If you are interested in the vaccine, you want the documents, you want the literature on the vaccine, the Ministry of Health is available to give you that. Social media does not always help, because there is always somebody for motive behind the scenes. And I will tell you this, I saw a guy who took the vaccine the same day with me. That's early in the year. On the boulevard, discouraging people from taking the vaccine. That is a human being without a conscience. But you've taken both doses.
Safe.
So you must have some mental issues to have been there doing that, and you know very well you took the vaccine. If you are not interested in taking the vaccine, you are not interested in the literature, allow somebody to make a decision to save their life or their family, their loved one. And we want persons to understand, if probably the vaccine had any negative side effects, probably I would be behaving differently. But so far, I took the vaccine in the first week that it was rolled out. My mother, my father, my household, and close friends, and we're all doing okay.
And that statement there coming from the Vice President for the National Council of Public Transportation, we said it better ourselves in encouraging individuals to continue to adhere to those protocols, and certainly to seek out the information. Go get the information from the official sources, from the competent sources for the information on the vaccine. Because what we do know, how much we always say here, we know that wearing the mask, sanitizing, keeping the social distancing, these things work. But in order for us to go the extra yards, we need to be able to have further protection. And all we have so far is the vaccine, and it is proven to be of absolute protection. So you don't want to need the vaccine and didn't take it, yeah? So we don't want that. We want to see, Dwayne, if we can get to the video as we close off. Remember the Chief Medical Officer, Dr. Sean Belmont George, did make a statement confirming new cases of the Delta variant in St. Lucia.
The Ministry of Health, Wellness and Elderly Affairs continues to manage the fourth wave in country. From July 25th, 2021 to September 26th, 2021, we noted a total of 5,703 cases, average of 91 cases per day. During that period, we note 94 COVID-19 deaths with a case fatality rate of 1.6%. Females account for 53% of the deaths. The average age of the deaths is 66 years. In relation to this new wave, from July 25th, 2021, 5,703 persons were positive. 51% in the age group 25 to 49 years, 57% of the cases are female. The majority of the cases are from Castries, Grosville, Fort and Babonneau. Today, Monday, September 27th, 2021, the Ministry of Health, Wellness and Elderly Affairs received notification from the Caribbean Public Health Agency of 9 new cases of the Delta variant. All of the cases are nationals. The majority are from Castries and Grosville. 5 of them are female, 4 are male, and the ages range from 18 to 60 years. Based on contact tracing data, the majority of the cases that we are seeing right now are acquired from non-adherence to the recommended protocols. We note excessive social activity, especially on weekends, even during the curfew hours. The contact tracing team has informed of The positive cases providing false contact information, withholding their place of employment and contacts. This prevents us from tracing and testing in a timely manner. The respiratory hospital also reports that many persons remain at home with respiratory signs and symptoms for extended periods and only access care at the critical stage, which leads to poor outcomes. We advise the public to access care at the respiratory clinics or the respiratory hospital if unwell. Signs and symptoms of concern include shortness of breath, difficulty breathing, tightness or pain to the chest, feeling weak, pale or blue-colored skin, lips, or nail beds. If you have chronic conditions, please get reviewed by a healthcare practitioner if you suspect that you may have COVID-19. The positive cases in home care are reminded that they are not to leave their place of isolation. They contact the home monitoring team or a healthcare provider via telephone with any concerns that they may have. Family members and friends are advised to deliver groceries and needs to those persons who are positive in a safe manner. By supporting each other, we'll get out of this. We continue to ask the public to work with us and exhibit responsible behavior to manage this fourth wave. Let us all take personal responsibility to keep ourselves and families safe. At present, we have both the Pfizer and the AstraZeneca vaccine free of charge in country at the various wellness centers. These vaccines have been proven to be safe and effective in preventing persons from developing COVID-19, its severe forms, complications, hospitalizations, and death. With the high level of community spread noted in the country at this point, we continue to advise the public to remain vigilant, adhere to the protocols that are put in place to keep us safe. These include regular hand washing, the use of face masks in public places, avoiding crowds and persons with respiratory symptoms, and keeping frequently touched surfaces clean. The Ministry of Health and Wellness will continue providing updates to the public as new information becomes available.
There, Dr. Sharon Belmont-George, and we know that with the Delta variant, and it is more highly transmissible, it leads to more hospitalization, more deaths. So what we want is for us all to do all that we possibly can within our power to ensure that we do not have the crisis on our hands, because the Delta variant is serious business. Before we close, you want to just take a look at what's happening to us west?
Sure, I could do that, Lisa. Today winds will be blowing between the east and east-southeast in around 9 miles per hour, 15 kilometers per hour, becoming lighter at times. We're in St. Lucia for the next 24 hours, expected to be fair to occasionally cloudy skies with a few scattered showers. There is a chance of afternoon thunderstorms, so you can look out for that and ensure that you have your protective rain gear with you. I'm not looking at you, Lisa. Not doing that. Sure not doing that. I thought the Castries Harbor be low at 1:12 p.m. and at the V4 Bay low at 2:39 p.m. Seas slight to moderate today with waves 3 to 5 feet or 0.9 to 1 meters. And I see some activity in the tropics.
Yes, it's moving quite quickly. There's moisture and instability associated with a trough coupled with a light wind regime, and that's going to generate cloudiness, showers, and isolated thunderstorms across of the Eastern Caribbean region during the forecast period. Can we please get some of that rain? It's really humid here. And at 5 a.m. today, the center of Hurricane Sam is still out there. It's located near latitude 11.5 degrees north, longitude 42.2 degrees west, about 1,470 miles southeast of the northern lead. And Sam is moving towards the west near 18 miles per hour. And this motion is expected to continue through tonight. A decrease in forward speed and motion towards the west-northwest That's expected over the weekend. The maximum sustained winds have increased to near 75 miles per hour, and rapid intensification is forecast to continue. Sam is likely to become a major hurricane again tonight or early Sunday. So let us we are advised to continue to monitor the progress of the system. So let's do that as much as we can. All right, that will do it for us here on this Tuesday. I want to thank you so much, Kentry Frederick, for coming on by. I know the notice was short on our part, so thank you so much for coming in. And we do hope that the partnerships that you are forging through COVID-19, and those partnerships are going to continue throughout the years.
Thank you very much, and have a nice day.
So, Homer, that's it from you?
That's it.
That's it from us here. Thank you so much. Tune in again tomorrow for yet another exciting program with lots of information for you. I'm Lucia Joseph on behalf of Homer DeMar. Bye.